I welcome Dr. Safia Rahman. She is a well-known doctor at Yeshaswi Dental Clinic and Prime Dental Care at Bangalore. She is going to present an old pandemic meets the new, a review. Dr.
Am I
Safia,
audible, doctor?
yes, please, you are audible. Go ahead with your presentation.
Yeah. Good afternoon to all the dignitaries. I'm Dr. Safia from Bangalore Institute of Dental Sciences, Bangalore. My topic is an old pandemic meets the new. As we have seen in the last 2 days, that tobacco causes 8 million deaths every year from cardiovascular diseases, lung disorders, cancers, diabetes, and hypertension. It is also linked to a detrimental impact on oral health, such as increasing risk of periodontal disease, periimplantitis, implant failure, and oral cancers. Contents of a cigarette. Next slide, please. Contents of a cigarette. We have seen that there are 7,000 chemicals in a cigarette, and like nicotine, acetaldehydes, phenols, carbon monoxide, and more than 70 of them are carcinogens. Smoke also has liquid aerosol droplets, close to 20%, which is close to 20% of water. Next slide, please. Coming to the effects of tobacco on health, we have seen that there is an increased risk of strokes, oral throat and stomach cancers. It also affects the fertility in both men and women. There is premature aging of the skin. It causes osteoporosis, and as we have seen that it causes increased risk of heart diseases and lung diseases. Next slide, please. Effects of tobacco on oral health. We have seen majorly staining of teeth and precancerous lesions like erythroplakia and leukoplakia, precancerous conditions like oral submucous fibrosis, periodontitis, periimplantitis, and malignancies like squamous cell carcinoma. Next slide, please. Coming to the effect of tobacco on respiratory system, we have seen that tobacco smoke will cause continual bronchial irritation and inflammation, and it also causes breakdown of elastin in connective tissue of the lungs. This will lead to chronic bronchitis and emphysema, which in turn lead to airway obstruction and frequent infections, which will cause hypovolemia, hypoxemia, and hypoventilation. As we have seen that there is chronic exposure of airway to the cigarettes. Next slide, please. Chronic exposure of airway to cigarette smoke. This will lead to persistent extreme oxidative stress, which causes which is basically reactive oxygen species in the cigarette smoke, as well as from smoke-activated neutrophils. This in turn causes cytotoxic effects on resident cells of adaptive and innate airway immune system, as well as structural cells. Oxidative inactivation of intracellular signaling mechanism, which trigger airway host defenses, which in turn leads to dysfunction of the airway, which predisposes to pulmonary infection. Next slide, please. Tobacco smoking is a known risk factor for respiratory infection, and WHO on 29 April 2020 found that smokers are more likely to develop severe respiratory diseases with COVID-19 compared to non-smokers. COVID-19 is an infectious disease that primarily attacks the lungs. Smoking makes it harder for the body to fight off. And that is why I say that it is an old pandemic which is meeting the new. And because of this, let us see how smoking actually is in association to COVID-19. We have seen that there is higher expression of ACE2 in smokers compared to non-smokers. And the SARS-CoV-2 virus is having more, next slide, please, is actually binding more to the ACE2 receptors and hence internalizing the virus and leading to infection. Next slide. According to Stannon in 2020, in a peer-reviewed meta-analysis, found that smoking was associated with more than a doubling of odds of disease progression among people who had already developed COVID. And Zeber et al. In 2020, in a systematic review and meta-analysis, found that calculated relative risk showed that current smokers were 1.4 times more likely to have severe complications compared to former and never smokers. Current smokers also had a higher mortality rate of 38.5%. Next slide, please. And that's why cessation is the key to prevent infections. WHO in 2007 has given us the 6 Empower measures. Using this, we can try and help in tobacco cessation. Next slide. Hence, I conclude my presentation by saying that smoking already preys on the lungs, and COVID-19, along with it, will have a synergistic effect which will wreak havoc with our body. Thank you.
Thank you, Dr. Safia.